Anxiety disorders in children, an overview. Anxiety disorders in children are conditions where persistent and excessive fear, worry, or nervousness interfere with their daily lives, including school, social interactions, and family activities. While occasional anxiety is a normal part of childhood, e.g., fear of the dark or being away from parents, an anxiety disorder occurs when these feelings are overwhelming, last for a prolonged period, and significantly impact the child's functioning. Common types of anxiety disorders in children. 1. Generalized anxiety disorder, GAD, persistent, excessive worry about various aspects of life, e.g., school performance, friendships, family safety. Symptoms include restlessness, fatigue, difficulty concentrating, and physical complaints like headaches or stomach aches. 2. Separation anxiety disorder, intense fear of being separated from parents or caregivers. Refusal to go to school, sleepovers, or other situations where separation occurs. Physical symptoms, e.g., nausea, headaches, when anticipating separation. 3. Social anxiety disorder, social phobia. Fear of being judged, embarrassed, or humiliated in social situations. Avoidance of speaking in class, joining groups, or participating in activities. 4. Specific phobias. Intense fear of specific objects or situations, such as animals, heights, or darkness. These fears are out of proportion to the actual threat. 5. Panic disorder. Recurrent panic attacks, which are sudden episodes of intense fear accompanied by physical symptoms like a racing heart, shortness of breath, or dizziness. Fear of having more panic attacks may lead to avoidance behaviors. 6. Selective mutism. Failure to speak in specific social situations despite being able to speak in others, e.g., at home. Often linked to extreme social anxiety. Causes and risk factors. Anxiety disorders in children result from a combination of factors. 1. Biological factors. Genetic predisposition, a family history of anxiety disorders. Imbalances in brain chemicals, e.g., serotonin, dopamine. 2. Environmental factors. Stressful life events, e.g., divorce, moving, loss of a loved one. Overprotective or critical parenting styles. Exposure to trauma or abuse. 3. Psychological factors. Temperament. Children who are naturally shy or inhibited are more at risk. Learned behaviors. Observing anxious behaviors in parents or caregivers. Symptoms of anxiety disorders in children. Emotional symptoms. Excessive fear or worry. Irritability or mood swings. Difficulty concentrating or making decisions. Avoidance of feared situations or objects. Physical symptoms. Stomach aches, headaches, or other unexplained aches. Fatigue or difficulty sleeping, e.g., nightmares or insomnia. Sweating, trembling, or a racing heart. Behavioral symptoms. Clinginess to parents or caregivers. Meltdowns or tantrums in anxiety-provoking situations. Refusal to attend school or participate in activities. Diagnosis. Diagnosis involves 1. Assessment by a professional. Pediatricians, psychologists, or psychiatrists evaluate symptoms, behaviors, and family history. 2. Observation. Information from parents, teachers, or caregivers about the child's behavior in different settings. 3. Standardized tools. Anxiety scales or questionnaires to measure the severity and type of anxiety. Treatment options. 1. Psychotherapy. Cognitive behavioral therapy, CBT. The most effective treatment for anxiety in children. Helps identify and change negative thought patterns and behaviors. Exposure therapy. Gradual exposure to feared situations to reduce anxiety over time. 2. Family therapy. Involves parents and siblings to create a supportive home environment. Teaches parents how to model calm behaviors and manage their own anxiety. 3. Medication. Prescribed in severe cases when therapy alone is insufficient. Common medications include selective serotonin reuptake inhibitors, SSRIs, under close monitoring by a healthcare provider. 4. Lifestyle changes. Regular physical activity. Adequate sleep and a balanced diet. Relaxation techniques, e.g., deep breathing, mindfulness. Helping a child with anxiety. 1. Provide support. Listen to their fears without dismissing them. Reassure them and validate their feelings. 2. Promote gradual exposure. Encourage small steps toward facing fears rather than complete avoidance. 3. Model calm behavior. Children often learn by observing adults. Managing your own stress can help them cope better. 4. Set routines. Predictability can reduce uncertainty and help children feel secure. 5. Celebrate success. Praise efforts and small victories in managing anxiety. When to seek help. Symptoms persist for weeks or months and interfere with daily life. The child avoids activities or situations they previously enjoyed. Physical symptoms become frequent or severe. School performance or social relationships are affected. Early intervention can make a significant difference in helping a child manage anxiety effectively and improve their quality of life.